Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Riziki Kaluki Ahmed. I'm a clinical psychologist and I'm the chairperson of the Muslim Psychologists and Counselors Association, and I also sit on the Committee of National Muslim COVID Response as the mental health chair. So today we are going to talk about the mental aspect of COVID-19 and the interventions that are currently in place. So what we know is that COVID-19 is a global pandemic, and it's something that the world has never experienced. So it's something that evokes a lot of feelings and emotions, and these are arising from the challenges that we have all faced during this time when there's been the COVID-19. We have had what we call isolation, we have had lockdowns, we have had to work from home, we have curtailed so many of our normal routines. So all this affects our emotions, to name but just a few of the challenges. Some of the biggest challenges we all have been facing is fear of infection. We all don't want to get infected with the virus because we don't know how we are going to go through the illness. We have seen people getting very sick and being taken to the ICU, others not having symptoms. So we have a fear of we don't know what can happen to us. And then also the lack of resources, because having COVID-19 and being hospitalized, actually we have seen people use a lot of resources, especially if they have to be in the ICU. We have the fear of the death and fear of the loss of loved ones. We have seen in places when COVID-19 started having a big havoc on the world, we saw very many deaths in countries like Italy, countries like Spain, and of late where we had India, where we saw massive death rates. So all this creates a lot of fear in all of us, the fear of losing our loved ones. We have also lost our loved ones to COVID. We have people who still have their loved ones in hospital. So all these are challenges that we are facing due to the COVID. Then the fear of the side effects of the vaccine. There's a lot of stories going around about the vaccine, the side effects. So people are also very fearful. They want to have the vaccine, but they're very fearful of the side effects. So we are living with lots and lots of emotions. And then we are also having very high death rates because of COVID. Because you can have in a day, we are seeing a number of 20. This is not something that is common to us. Then we also have the loss of jobs, loss of livelihood. Our economy has really been battered by COVID-19, which all goes to affect our mental space. Then increased isolation and loneliness. We had schools when we knew that schools were not operating. Children had to stay at home. They are used to being with their playmates, so they couldn't be with them. So there was a lot of loneliness, and also a lot of being told stay at home. So it increases a lot of loneliness. And for anybody who already has issues with loneliness, it can actually go on to bring up issues of depression and anxiety. So also drastic change in the way we move. We'd find there'd be a lockdown and people could not go to places like Mombasa, or people in Mombasa could not come to Nairobi. Or at times there's a lockdown where we say Kiambu has been locked down, or you can't go to Kisumu. So all these changes and the way we move actually affects us. So we've seen a lot of problems, and people have been going through all this, and all this needs a lot of mental health interventions, because we are human beings and we have feelings and emotions. So it's very important that we are aware. So what are the signs of stress that leads to anxiety? So it's important for us to understand that with all this happening around the world, happening within our country, happening within our counties, happening within our own families, we are human beings, we do get affected. So some of the signs that can show that we have stress and anxiety are when we get intense fear, sadness or numbness, having a sense of hopelessness and feelings of being helpless. Like at times we feel there's nothing much somebody can do. Having irritability and anger outbursts that are quite frequent, feelings of frustration and apathy, feeling like you don't even want to do anything. Physical reactions, poor and erratic eating habits, not eating well, not eating on time, skipping meals, not being sure when you're going to have your next meal because you didn't plan. Physical reactions, we said the poor eating habits, poor appetite, digestive tract problems, having a lot of gas or acidity, or having bouts of diarrhea or constipation where you just feel your tummy is not settled. Worsening of already chronic illness symptoms. If somebody has diabetes, they start feeling like their diabetes symptoms are getting worse than what they were before. Or somebody with high blood pressure and they find that their pressure constantly keeps going up. And also unexplained fatigue, feeling tired the whole time. Even if you go to bed and rest, you don't feel like you have rested. So all these are signs of stress and anxiety. Increase of taking up bad habits. So at times people who maybe chew miraa, they find that they even increase the amount of miraa they take. Maybe they used to take on a Saturday only. They find they're also taking the miraa maybe during the weekday. Or people who smoke cigarettes, they find they're smoking too much. And we also noted that people maybe who take alcohol, we've seen there when they go to the supermarket, people would actually pick more of the alcohol than even the food. So because of all this, we see an increased level of picking up of habits that are not really healthy and also that we know could be haram. So increase of bad habit is something we have seen, and also increase of use of bad substance. So all these are things that are happening because of the stress and anxiety. So I'm just going to give a few tips on how we can manage our stress and anxiety during this time. So if stress and anxiety are not well managed, they can actually lead to one feeling hopeless, feeling helpless, and can give us debilitating kind of symptoms that can lead to panic attacks, can lead to depression, and even can lead to suicidal thoughts. So this is something that we need to take very seriously and keep working on it and keep talking about it. So the guidelines set by WHO reflecting on the COVID-19 and the flattening of the curve. So it's very important that the one thing we do is we are very aware of what are the COVID-19 rules within our country and try to maintain that. If we are told to maintain social distance, we try as much as possible to do that, wear our masks, have sanitizers, and avoid having crowded places or even having crowded occasions like we have been seeing, rallies where people come in large numbers. It's very important to avoid such places. So we have to follow what is being told. And I know that when we talk about isolation or keeping away from very crowded places, some people feel isolated and feel lonely, and this can also trigger their stress levels. But it is important for them to understand this is for their own good. So one is, it is okay to accept when we are not feeling okay. So it's okay not to be okay. It's okay to say, I am not feeling at peace, I'm not feeling well. Accepting what we are feeling is the first step to healing what we are feeling. Accepting our emotions and feelings as being part and parcel of us and being normal responses to what is happening around us. And remember, when we are feeling threatened, we will react. So even now, our lives feel threatened. We don't feel like everything is as it should be normally. So we would have those responses, and we need to accept them as being normal. Focus on what is within our control. So when we talk about focusing on what is within our control, we have to look at, when I look at everything that is happening, what is it that I can control? So I can control my not maybe getting infected by making sure I wear my mask, I carry my sanitizer, I social distance. That is within my control. But I cannot control whether it will rain tomorrow, whether there will be job losses. So I shouldn't concentrate so much on things that I cannot control. Then we should channel our energies on things that are actually of benefit to us, and also on creative activities. Let us not just channel our energies on fear, channel our energies on worry, channel our energies on overthinking. So we should look at what are the other things we can do that are creative, and also create interests that maybe we've not been taking care of. Maybe even learning a new language. If somebody doesn't know how to maybe recite the Quran very well, they could join such classes, they could join Arabic classes. Do something creative that makes you feel a sense of achievement. Practice healthy stress management skills, and also seek help when one is in really need. Practicing healthy stress management skills is first understanding what are your stresses, what is it that you can do about it, what are the possible solutions, and working with those possible solutions to bring down your stress levels. The other two is creating and maintaining sustainable self-care. So when we talk about self-care, it's very important to know that our physical self, our emotional self, our spiritual self has to be taken care of. So there are so many dimensions of self-care. So if it is our spiritual self, we look at how is our relationship with our Creator. Are we performing our salah when it is needed? Are we reciting Quran? Are we doing adhkar? Are we doing dua? Even to ask Allah to protect us from this illness and protect us from anything that can be of a big challenge to us during this time. So our spiritual self-care, and then our physical self-care. Are we sleeping well? Are we eating well? Are we doing any form of exercise? And most people, when they hear exercise, they think the gym. Exercise can just be a routine where you create for yourself. Every day you have a 20 or a 30-minute walk, and you make it like a daily routine, because exercise is something really healthy. It gives us those endorphins, which are feel-good hormones, and it also increases our energy levels, and also getting a good sleep. So creating a good sleep routine, where we try as much as possible to have at least 8 hours of uninterrupted sleep, and try not to carry our screens to the bedroom, not to go with the laptop to bed, the phone, the television. Try and avoid as much as we can during sleep time having all these gadgets, because they interfere with our sleep patterns. And then making sure that we talk with our friends, we engage, whether it's reaching out to our families through the phones or even Skyping if they're not in the country, but we make sure that we are maintaining that personal touch with our closed and loved ones. And at times also bonding with the nature, just going for nature walks. Maybe you can go to a place like Olelua, you can go to Karura Forest, you can go to places where you just have this nature around you, which makes you feel really connected and actually releases your stress levels. So those are just some of the few things that we can think of doing, so that we are able to feel much better. And also working with the community. We know we have orphans in the community. We know we have people who have less than we do. So we look at how else can we work with this community. If you're somebody who finished university, how can you maybe tuition the Muslim youth who are maybe doing their O-levels, or even the class 8 students, even working, maybe going to a children's home and helping out. So working with the community is also one way that makes one feel less stressed, and giving of yourself actually is a very nice thing, which makes you feel more at peace with yourself and also with your community and with your Creator, Allah subhanahu wa ta'ala. So it is very important that we do all that. And then if we feel that we are still not able to manage, talk to a loved one. If you're not able to talk to a loved one, you can actually seek professional help. and you can call and talk to someone. So the important thing is to always remember you're not alone. You can always call and talk to someone. COVID-19 is a big challenge, and it's something that we've never had before. So the other thing we've been doing is we've been training people on what we call the psychological first aid training. So psychological first aid training is a training we've been doing that has been occasioned by the WHO, and we do it to train people who can work with anybody within the community who are also going through the challenges of COVID-19. So it's a support that is used to support people during the COVID-19 response in many countries, and also here in Kenya. So when we talk about psychological first aid, which we also call PFA, we train people so that in case there's a spike maybe in a certain area, these people are able to manage the people within that area, their emotions, so that by the time we are done with having that high rate of infection within that area, the people come out when they are emotionally stable. We have seen there's an increase in suicide rates within the country. We have seen there's an increase in homicides, in a lot of gender-based violence, and this can be occasioned by people not being able to manage and regulate their emotions during this time. And that's why we train these people so that they can reach out to these people. Anybody who is been infected by COVID-19, anybody who has family members who have been infected, anybody who has lost their livelihood, or anybody who feels isolated, they will need to be taken through the psychological first aid so that they are able to cope with whatever is happening to them. So when I just give a brief outline of what the psychological first aid looks like. So when we are training, we give the definition of psychological first aid. We give the place of psychological first aid and the overall response. We give the who gets the psychological first aid, when and where. And then psychological first aid has what we call the action principles, which are prepare, look, listen, and link, which we teach so that the people who are actually on the ground understand what these principles are. We talk about safety while intervening. The person who is also intervening and offering the psychological first aid, they need to be safe. They need to take care of their own safety, ensuring that they don't get infected in the process or even have their lives endangered when they are offering psychological first aid. We also talk about special populations. These are people maybe who have disabilities, or very young children, or mothers who are nursing, or pregnant women. And then we also talk about the ethical guidelines. Whoever is offering the PFA has to follow certain ethics, and also the people doing the psychological first aid, being teams of people, they have to care for themselves and their team members. So the good thing about psychological first aid is once people have been trained, they don't have to be psychologists, they don't have to be counselors to offer psychological first aid in the community. So once they have been trained in PFA, they can go ahead and offer psychological first aid in the community, and that is what we have been working a lot on. And during this time, we have had to train maybe using Zoom sessions, because at times we are training people who are maybe in the other parts of the country. So as National Muslim COVID Response Committee, we have done a lot of trainings on PFA. We've trained in very many areas within this country and within Nairobi. We have trained very many different people. So at least we are very sure that we have people who are well trained who can offer PFA in the places that they are in. And we continue offering PFA in more and more places every time we visit. So we have gone around the country. We have gone to Mombasa, we have gone to Nakuru, we have had people go to Nyeri, we have gone to Murang'a, we have gone to Kitui, we have gone to Machakos, we have gone to Kajiado. So this PFA has been offered in so many areas within our country. And in Nairobi, I would say in very many places within Nairobi, in places like Dandora, Umoja, South B. We have been to places like Coach. So very many places we have offered a PFA and on the ground. So we go in as National Muslim COVID Response Committee, and when we are training on the science of COVID, the religious aspect of COVID, we always make sure that the mental health aspect is also covered. And the mental health aspect, when we are covering, we make sure we talk about the PFA. So when we are talking about PFA, we always have to remind people that it's not only professionals who can do this. Anybody who has been trained can actually go ahead and offer PFA. So when we talk about definition of PFA, we define PFA as humane, supportive, and practical assistance to fellow human beings who are currently suffering exposure to serious stressors during this COVID-19 pandemic period. We say PFA is not intrusive, it is practical care and support. It is assessing the needs and concerns of the people. It's helping people to address basic needs. It's listening but not pressurizing people to talk. It's comforting people and helping them to feel calm. It's helping people connect to information, services, and social support. And it's also protecting people from further harm. So PFA can be seen here as a very important component of working with the COVID-19. So when we're talking about how people respond to crisis, we teach that they are based on certain factors. We have what we call personal factors, and personal factors are age, education, health, previous experiences with something like this. If I have lost somebody to COVID-19 and I get sick, then maybe I will react differently to somebody who has not lost anything. So those are what we call personal factors. We have what we call crisis events. How big is the crisis event? We know that COVID has been ongoing for quite some time, and it's a pandemic, it's something that is global, so it's quite a big event. We also look at the local environment. How stable is the local environment? What are the resources available? So for us, we'd say we are in a country that is at peace, so it's very easy for us to access resources. We are not having war, we are not having clashes. So we look at all those kinds of things when we are talking about the people, how people respond to crisis. And also we look at the communities. So we would say communities currently are actually having many things they are trying to do to help their loved ones with COVID-19. And we have seen Muslims coming together and fundraising for people who are in the ICU, the people who have lost their loved ones, to help bury. We have facilities where people can help bury their loved ones. We even have a Janaza team that has been working closely with the community to help when there's COVID-19 deaths. So we can see all these things have been really helping. So when you talk about PFA, we further will ask, why do we offer this PFA? So we offer PFA because we say anybody who goes through psychological first aid will not have long-term effects like what we are seeing, a lot of homicides, a lot of gender-based violence. So they'll be less reactive to other things later on in life. They will feel more safe and connected to others. They'll be more calm and hopeful. They feel that they have access to social, physical, and emotional support, and they regain a sense of control faster, and they're able to help themselves much more easily than when we don't offer any psychological first aid. So it's very important for us to understand. So who gets psychological first aid? We said people who are distressed and may have symptoms of COVID-19, people who have been exposed to COVID-19, or people who have patients already who have COVID-19, people who are already infected or are having a lot of fear of infection, people with other underlying health problems like diabetes, chronic illness like cancer. We have seen people having a fear of even going to hospital for their own usual treatment. So PFA can be offered to both children and to adults. And it's important to note that not everyone who goes through a crisis event will require PFA, and we also don't force it on anybody. So we give it to people who are in need, and we don't force it on anybody. So there are those who we feel require more advanced support than just PFA, and usually we refer them for further interventions by either a psychologist or a psychiatrist or even a medical doctor. So PFA can also be an assessment tool and a referral tool. So after going through the PFA, we also can refer this person for further interventions to people who are more qualified, like maybe a psychiatrist or a psychologist. So PFA is offered wherever somebody comes across these people who are in need of help, and it has to be in a place that is quiet, and the person's whatever they are saying has to be respected, and is also treated as confidential. So there's a lot of confidentiality and dignity for the affected person that has to be maintained. We have also looked at you doing it through virtual means, especially in places when there's very high rates of COVID-19. So when I explained the principles, I said there are 4 action principles of PFA. The first one is prepare. So preparing is, if we hear that there is a problem, maybe in Kisumu there's a high rate of COVID, we need to understand the crisis event, what is happening, what are the numbers, how many people are dying, how many people are sick, what is the infection rate before you just go in. You must learn about the available services and support. So we find out what is already on the ground, what are the available support. If I'm to refer somebody, where would I be referring them to? Learn about the safety and security concerns in that area before we go into to intervene. 2, we do the look, the principle. We observe for safety. If I go in, or if somebody is going in to intervene, how safe are they from maybe getting the infection, or also for their own physical safety from any form of injury. Observe for people with obvious urgent basic needs. So we also look at what are these people's basic needs at that particular time. Observe for people with serious distress reactions. So anybody who is looking highly distressed, they don't look well, all those people are also observed for. And also observe for people who maybe have symptoms of COVID-19, people who need isolation, people who need to be taken to hospital so that they can be rightfully referred. Then we have the next one is listen. So when we are listening, this is when you say you make contact with the people who need support. Ask about the people's needs and concerns. We don't assume what are their needs. We ask to find out what are their concerns. Listen to people and help them feel calm. So it's very important, even at that point when things are looking really bad, that these people are still helped to feel calm and feel that everything is under control. And then the last one is link. Link is where we say we help people address basic needs and access. So we link them to services. So we find out if we are in Kisumu, who is offering maybe food. So we link them to that person or to that organization. Which organization is offering medical support? So we look at which organization is there. So we look at what is there and we try and link the people to that. Help people cope with the problems. So when we are linking, we help people cope with problems. If it's a gender-based violence, problem, we try and understand what is happening and link them to a service that will help them deal with that problem. Give them information, let them understand. If it is vaccination, where is the vaccine being done? When is it available? Give information on COVID-19 because there are many rumors. So we make sure that we give the right information so that people can be more aware of what is going on. Connect people with their loved ones and their social support. If somebody is in hospital and they have not been able to see their loved one, we try and see how they can connect with them, even if it is through just the phone, the communication through the phone. And this will help this person get to heal faster and to feel they have more control over their illness, because this is an illness that can make you feel like you lack control. So those are some of the things we talk about when we're talking about psychological first aid. We also address issues of people with chronic health conditions. We also talk about people with disabilities, and we also talk about children. And we also discuss good communication skills, things to say and things not to say when you're offering PFA. So it's very important that confidentiality of whatever a person shares is maintained, because you could have somebody who is telling you, I have HIV and I have also contracted COVID-19, so I am fearful of my condition. So it is not your place to go talking about the status that they shared. So confidentiality has to be maintained. So communication is also taught when we are offering PFA, to make sure that there is good communication and people understand what are the things they can say and things they cannot say. We also have what we call the ethical guidelines. So in the ethical guidelines, anybody who is being taught PFA, we teach them what are the do's and don'ts of psychological first aid. So they go through the ethical guidelines so that they understand what are the ethical guidelines. And one of the most important is always to respect the rights of people to make their own decisions. So we don't go around making decisions for people, even when we are offering psychological first aid. And to also set aside our own biases. We know we have our own biases, but during the time when we are offering psychological first aid, we understand our biases and our prejudices, and we try and set them aside. Make it clear to people that even if they refused help, they can still come and access this help later. Respect privacy of the person's story and behave appropriately with the person that we are offering psychological first aid to. We don't make demands for any finance from these people. Neither do we ask them to give us information that they are not willing to share. So it's very important that we understand what are the ethical guidelines. So as we are offering PFA, it's very important that the person offering PFA also takes care of themselves. So we talked about self-care being a very important component. Otherwise, this person can easily get burnout and not be of any help. So currently, the mental health team is having a hotline number where one can call and they can actually get somebody who can talk them through what they are going through and be able to refer them to the right facilities. And we are currently continuing offering the PFA training to different people in different parts of the country. And we hope that whoever has learned this can make use of it and help their community. So with that, I'd like to thank you very much for listening to this talk on mental health aspect of COVID-19 and the response that we currently are doing. And I'd like to thank all the counselors that we have been working very closely with. We've worked very closely. We've had very many Zoom sessions to address some of these issues that we are talking about that affect people. And we still are working on that. And we pray that Allah rewards all of us and all the people that are on the ground working. And we thank the Executive Committee of National Muslim COVID Response for working a lot to help us continue helping the community. Thank you very much. Jazakallah khair.